Hello, everyone. I'm Maurice Jones, Chapel Hill Town Manager, and I'm joined by Chapel Hill Police Chief Chris Blue and Fire Chief Vince Harris to provide you with an update on the town's efforts to respond to the COVID-19 pandemic, especially in the areas of public safety. I wanted to first thank the residents of Chapel Hill for the impressive way you have managed this crisis. All of us in the town are grateful that our community has responded so well to the stay-at-home orders that are in place and are practicing proper physical distancing when you have to travel out. Thank you for that, and we ask you to continue to do that as we go through this crisis. Our first responders are on the front lines of providing support to our residents, and we are working to ensure that they are properly supported to protect themselves and the people that they serve. This all begins for them with the training that they receive, and Chief Harris and Chief Blue are going to give us a sense of what type of training our first responders go through and have gone through well before any of us had heard the term coronavirus. So Chief Harris, do you want to give us some update on the training that our first responders go to?
Sure. Training for these type of events start way back when we start training in rookie schools and academies. It's very similar to the hazmat training we receive when we learn how to properly use our PPE, when to don it, when to doff it. It also goes into our EMS response training and our bloodborne pathogen exposure training, so we can understand routes of exposure, how we're exposed, how we can prevent that, and what we can do from a cleaning and a deconning standpoint to make sure we're not spreading any contaminants around places like the stations, our equipment, our trucks, or even taking it home to our families.
And I would add, of course, our police officers go through the same kind of bloodborne pathogen training that every year requires us to refresh our skills on, as Chief Harris said, donning that ever important PPE. I would also say that the kind of management structure that goes into organizing around a long-term response like the one that's underway right now is also something we train for very early in our public safety careers, the kind of incident command model that assigns certain roles and is able to sustain your operations through an extended period of time. So although these are unprecedented times, certainly, I think our training that begins at the start of our public safety careers is serving us well right now.
Well, this crisis is certainly, I'm sorry, Chief, go ahead.
And that training continues. We do quarterly refresher training for these type of events and environments to make sure we stay up to date and are following proper current procedures on how we do this.
And this crisis has certainly changed the way we do a lot of things in our lives, and the same can be said for the protocols that we have put in place for responding to 911 calls and calls for service here in town. Chief Harris, can you tell us a little bit about the change in protocol for 911 calls, and then what folks should see if they do have to call 911 and are expecting our fire personnel to arrive on scene, some of the things that would look a little bit different now versus before this crisis hit?
Yes, sir. Starting with the call, when a person calls 911 now, our county 911 center instituted a series of screening questions trying to get at the heart of the nature of your call and trying to kind of identify if this is a potential COVID-19 case or not. And when they dispatch, they give us this information, so it kind of regulates and governs how we respond to the calls. Now, where that affects the call response for the fire department is if this is a suspected COVID-19 case, we've changed our response procedure in that to minimize exposure to multiple firefighters and to conserve PPE, we will have one firefighter approach the patient and start assessing that patient. The other firefighters will stay back at least 6 feet to minimize exposure. If additional assistance is needed, those firefighters will step up and assist that firefighter as needed.
And another important part of what we're dealing with right now is our stay-at-home order that's in place both on the state level and then the county and town level as well. Chief Blue, I know that there have been a number of calls that you all have received in response to concerns that folks may have about mass gatherings. How do you tend to respond to those? I know first we wanted to make sure that folks understood that education was most important, but what should folks expect if they do call in about a call about concerns over folks who are not necessarily abiding by the stay-at-home orders?
Well, first, I want to reiterate what you said at the beginning of our discussion, is that we're seeing largely outstanding compliance with the order and just fantastic cooperation from our community. That said, we have gotten a number of calls about potential violations of the stay-at-home order or violations of the physical distancing expectations that are also found in those orders. What you should expect is that an officer or officers will respond. As we've said throughout this event, however, our priority is community safety, not enforcement. So our officers have very, very clear expectations set for them that they are going to interact and educate with the community members where a violation is alleged to have occurred. I would say that oftentimes we've responded and found that in fact violations were not happening. But that has given us a chance to educate anyway, just disseminate some information for folks so they can share with their neighbors. And our goal would be to come through this event having made no criminal charges whatsoever. But it is important to note that violation of the stay-at-home order is a Class 2 misdemeanor. If you're convicted of a Class 2 misdemeanor in North Carolina, that can carry up to a $1,000 fine and 60 days in jail. It is, of course, our goal not to bring any of those charges, and so far our community is doing an outstanding job in responding to this crisis.
Another phrase that we've all kind of gotten used to now that maybe weren't exposed to before was personal protective equipment. Chief Harris made mention of that a moment ago, PPE. Tell us about how we're providing personal protective equipment for our first responders and maybe what the needs are down the road.
Yeah, so right now there's a real shortage of PPE, so we're doing everything starting out to conserve what we can get. So when we respond to these calls, we're required to wear gowns that cover our clothing, gloves, masks, and eye protection to protect against any splatter. The rate at which we go through those, because we traveled up to 4 people on a rig, is why we've reduced our response down to 1 person making contact. But there's some other things that we also do to try to help with that in these times when our PPE shortage is getting worse. We're looking at different ways to wear our actual structural gear or anything else that can be deconned that could possibly be used. We're also exploring options with Duke University and UNC Health at maybe deconning those critical N95 masks. Those N95 masks are the ones that you see hospital workers and first responders wear. They're the ones that are rated for medical protection in these situations, and those are the real critical resources that we're looking at.
Well, thank you, Chief Harris and Chief Blue, for your time today and for your leadership during this crisis, and thank you also to all of your folks who are out in the field protecting our community.
Thank you, sir.
Thank you, sir.
Remember, folks, we all have a part to play in reducing the spread of COVID-19. Stay home, wash your hands regularly, avoid touching your face, and practice proper physical distancing if you have to go out in public. We thank you again for all you're doing to be responsive to the stay-at-home order and to follow these guidelines as we go through this crisis. And we thank you for your patience as we all go through these unprecedented times. We are in this together, and we will get through it together here in Chapel Hill. Be safe.